Hello everybody, hope everyone enjoyed the Super Bowl. In that vein, today we're going to talk about traumatic brain injury and CTE, Chronic Traumatic Encephalopathy. So traumatic brain injury is the generalized term that overlays all head injuries. And traumatic brain injury can be of several types. As a whole, in the United States, we see anywhere between 2 to 3 million patients a year, and some studies have gone as high as 3.5 million patients a year with traumatic brain injury. However, that being said, traumatic brain injury is a condition where the brain has undergone a certain type of trauma. It is divided into broadly mild, moderate, and severe. Severe traumatic brain injury is easy to identify. It's one of those patients who basically is in a hospital, identified to be unconscious, may even be in a coma, could possibly be intubated, and when a CAT scan of the head is done, it reveals that there is some hemorrhage inside the brain. There is also swelling of the brain, and could even be a skull fracture. Those patients are quite severe. They may undergo brain surgery at the emergency room through the hospital, or they may be in the intensive care unit because they're not able to support ventilation themselves. That's a severe form of traumatic brain injury. With regards to the next level of traumatic brain injury, it's moderate, where they may have some loss of consciousness, there may be some swelling of the brain, maybe a slight inflammation of a part of the brain, and they have some difficulty with remembering the facts of what happened. They have some difficulties with balance at the time of the accident, and they have continued difficulties with brain functions like balance, walking, thinking, and doing things on a repetitive basis. That's a moderate level of traumatic brain injury. That's easy also to identify through the emergency room. The part of traumatic brain injury which is more difficult to identify is called mild traumatic brain injury. Mild traumatic brain injury is quite a diagnosis that is done usually not in the emergency room, because most emergency rooms, when you have a mild traumatic brain injury, evaluate you because you may or may not have lost consciousness. You may just feel symptoms of headaches, dizziness, some balance disturbance, and you feel like you've sort of not yourself. The CAT scan of the head done at the emergency room for the most part would be normal in these cases, and they send you out with a couple of medications for the pain, and the diagnosis is that you may have had a mild concussion. However, those patients who continue to have symptoms of headaches, dizziness, difficulty in focusing, concentration, difficulty with remembering short-term facts, difficulty with coordinating stuff from one side to the other side, and following commands for a persistent basis for several weeks, several months, may have something called mild traumatic brain injury. And that is usually diagnosed in current medical dogma with a specialized MRI of the brain. There are two types of MRIs of the brain. One is an MRI that is anatomical. So if you take a photograph of your hand, you can see the fingers, you can see the palm of your hand, the lines and the creases, but you cannot see the movement of your hand. If you take a video camera of your hand, you can not only see the fingers, the number of fingers you have, the color of your skin, the creases of your hand, you can also see the movement of the fingers. That's more functional. So the new type of MRIs that are available, which are high strength MRIs, are called MRIs DTIs. They're diffusion tensor imaging MRIs. They also tell you if areas of the brain have been damaged and lost strength of sending electrical impulses, or have become partially scarred. That is called a functional MRI. Those functional MRIs are done in New York City in a couple of locations. Not every place in the country has them. They're a little bit difficult to find, but once you have them, it is incumbent upon the physician taking care of patients with mild traumatic brain injury, if they have chronic symptoms that are persisting, to get a functional MRI of the brain, an MRI DT of the brain. that tells you if there's any areas of the interconnecting fibers of the brain where one half of the brain connects with the other half of the brain are either slightly torn or slightly scarred or not having enough energy supplied to them. And that will give us a clue of where and why the patient's ongoing symptoms are, which part of the brain is affected, and why those symptoms are ongoing. Mild traumatic brain injury tends to affect areas of the brain that are right next to the base of the skull. The skull on the outside is very smooth, but on the bottom, on the inside, it's jaggedy. It's got sawtooth edges. So when the brain scoops over the base of the skull or the bottom of the skull, it can tear parts of the brain up and cause trauma to the brain, which is only visible usually if it's a small amount with the functional MRI called the MRI DTI of the brain. Most specialists who deal in this space, when they see a patient who has been experiencing complaints of headaches, dizziness, some balance disturbance, in spite of taking medications, and things are not really improving over the several months after an event, like an accident or a fall, and they're having difficulty with focusing, concentration, or they don't remember short-term facts, they're usually referred to a specialist who's a neurologist specializing in head injuries. Those individuals usually like to get a more sensitive MRI, like an MRI DTI of the brain. That helps us diagnose the condition more accurately and allows us to give a treatment plan to the patient of cognitive therapy, balance therapy, and medication management of the symptoms. Most of these patients, unfortunately, come late to treatment and diagnosis by a specialist because when they go to their primary care physician, they've been diagnosed with a concussion and the routine MRI of the brain is usually normal. And the primary care physician says, well, you had a concussion, it may be just that you're depressed. And they tell their spouses the same, and the spouses watch these patients at home not doing things the normal way. They may, if they're used to doing some household chores like taking out the garbage or cleaning the dishes in the sink, they forget to do that. They have to be told several times. Or if they leave the house and they're supposed to lock the front door of the house, they tend to forget to lock the front door of the house for several times in a month, and that becomes more of an issue because the spouse notices it, and the patients tend not to remember that. So those are all subtle signs of an ongoing problem that is complained of by the patient's family members, and then is brought to the patient's primary care physician's attention, who then possibly may think of sending the patient for a specialty consultation for a more accurate diagnosis than just a simple concussion. Once the diagnosis is made, as I said, a specialized form of treatment, that is cognitive therapy, balance therapy, and medication management, can be entertained to help improve the symptoms over time by 60 to 80%. It's never going to be 100%, but it'll improve so substantially that it will be minimally impactful on the patient's day-to-day living. That is mild traumatic brain injury. Now, because we just finished the Super Bowl, many people would probably be thinking about the word CTE, Chronic Traumatic Encephalopathy. That is a condition that was identified through the NFLs by several scientists and pathologists who found that on people who were football players with repetitive head trauma had areas of brain tissue that had multiple scars. That is called chronic traumatic encephalopathy, where you have multiple scars in different areas of the brain. So you may have it in the front of the brain on the left side, on the side of the brain on the left side, the front of the brain on the right side of the brain on the right side, and back of the brain on the right side. These multiple areas of the brain suggest that the head trauma has occurred numerous times and in different areas. And that usually points to people who are in a sporting event or a job type event that has repetitive trauma to the head, like football players, like boxers, even ice hockey players tend to get that. So those types of sporting events tend to foster chronic traumatic encephalopathy. The problem with chronic traumatic encephalopathy is it slowly eats away at the patient's personality. Because of the number of scar tissue that is present in these patients, the patient has difficulty in transmitting impulses from one side of the brain to the other side of the brain rapidly, so they're not able to process information rapidly. It's almost like your computer has got a virus in it and you know that there's a glitch because it's working slower. That's the same thing that's happening to your brain if you're in one of those sporting events like football, ice hockey, or boxing, for instance, even wrestling. So those types of patients tend to have long-term memory problems, long-term ability to function on their own. They can even get a condition called dementia pugilistica, where they get dementia from the repeated head trauma, and they can get Parkinson's disease from the same, like Muhammad Ali, the famous boxer who got Parkinson's disease. There are numerous football players that we know of that have had chronic traumatic encephalopathy. They have had multiple head traumas, and those football players who have that, unfortunately, will have a very, very difficult time overcoming those disabilities with just simple therapy and treatment because it's so widespread, the trauma. For that reason, now you see in the NFL, they're changing the types of helmets people wear. They're changing the rules of the football game to make it less head trauma based so that people cannot hit each other in the head on a head-on-head collision. They're also changing the rules on what happens to patients who are playing those sports who have a concussion. They follow a concussion protocol where they take the patient out of the game and the player out of the game, examine them, sometimes if it's severe enough, do an MRI, and keep them out of playing for some 2 to 3 to 4 weeks, depending on the severity, to allow their brain tissue to heal. And they also give different intravenous fluids to help the brain heal. And that seems to be the only way to treat chronic traumatic encephalopathy, is by preventing the problem ever occurring. So when football players or boxers have multiple head traumas with multiple concussions and loss of consciousness episodes, it is probably going to be incumbent on the sporting event administrators or referees to keep them out of playing for several weeks and months, if not sometimes even a year, because they have had a substantial amount of head trauma that can put them at risk for CTE that ultimately can lead to very severe debilitating conditions like Parkinson's disease or dementia or inability to perform any activities of daily living. So as a synopsis, to close today's discussion, traumatic brain injury is a very common condition. It happens 2 to 3 million times a year approximately. Some studies have it more, some studies have it slightly less. It is divided into severe, which is where the patients are usually in a hospital, have some brain injury, brain hemorrhage, in a coma for a short period of time. Moderate amounts where they're in a hospital, they have a slightly protracted amount of loss of consciousness, may have a little edema or swelling of the brain, may even have a small skull fracture, and usually have persistent symptoms for several months, if not years. A mild amount may have loss of consciousness, may not have loss of consciousness. They will usually have a normal MRI or CAT scan of the brain, will need to get worked up if the symptoms of headaches, dizziness, memory loss, personality changes, difficulty in remembering facts persist for several months, with a specialized MRI called an MRI DTI of the brain with high field strength magnet, preferably a 3T magnet, 3 Tesla magnet. And the last issue that we discussed was chronic traumatic encephalopathy. This is a very sad situation that occurs in contact sports like football, ice hockey, boxing, and wrestling. That being said, if patients have had multiple losses of consciousness, multiple concussions, they would probably be advised by their physicians and by the sporting event coordinators to stop playing that sport, given the risk of having CTE that can ultimately lead to severe dementia, Parkinson's, and being wheelchair bound or bed bound. That is the problem with CTE. Sporting events like football have taken an active and proactive approach where they've changed the types of helmets, changed the rules to minimize head-to-head contact, and also are very careful in recognizing a concussion early and sequestering those patients away from the sport for a short period of time. Well, with that, I will close today. I hope this was informative. If you have any questions, please feel free to post questions. We'll be able to answer. Thank you very much.